Hello, and welcome to the ACR Bulletin Podcast, the show where we cover the latest trends affecting radiology. I'm your host, Chris Hobson, and today I'm joined by Ian Weissman, DO, FACR. Dr. Weissman is attending radiologist at the Milwaukee Veterans Affairs Medical Center in Milwaukee. He's chair of ACR's Veterans Affairs Committee. He was ACR's 2019 Advocate of the Year, and he also serves as chair of the Outreach Committee of ACR's Commission on Patient and Family-Centered Care, or the PFCC. Dr. Weissman, it's a pleasure speaking with you today.
Thank you, Chris. It's my great pleasure to be here. I'm a huge fan of this excellent ACR Bulletin podcast series. There's tremendous content on this podcast series in many areas like economics, population health, and artificial intelligence. I always enjoy learning from my radiology friends and colleagues on this podcast who are all thought leaders. I thank you and your colleagues at the ACR Bulletin for all your excellent work.
Wow, thank you so much. We'll try to live up to those expectations today. Thank you. Well, today we'll be talking about a range of topics of particular interest to you, as I understand it, Dr. Weissman, including physician well-being, health equity, and the PFCC, like I mentioned off the top there. I think a good way to frame the discussion is by looking at a concept that you've touted called the joyful triad, which encompasses the topics we'll be discussing today. So can you please explain, first off, what the joyful triad is?
Yeah, I term the expression joyful triad of healthcare success to define the mission of our work on the American College of Radiology Patient and Family-Centered Care Outreach Committee. And the joyful triad of healthcare success consists of three important elements. So patient and family-centered care, health equity, and clinician well-being. It's a continuum of important patient-centered and physician care concepts, which are all interconnected. And I propose that if we pursue strategies to improve patient and family-centered care, improve health equity, improve well-being, both in ourselves and others, that this will result in a feeling of joy within ourselves. And joy is a very powerful internal emotion. So it's not affected by what's happening around us. As an example, a child is able to tap into joy. A child can be surrounded by turmoil, but they can still experience joy. And we've all seen this in children. And we still have this ability as adults. And you've met people who carry joy within themselves. They're wonderful to be around. So being able to tap into joy is an important way to maintain well-being in ourselves. And I'll share some examples of actions that result in joy for me. So when I call a patient home to share urgent results, which speeds up their care, this gives me joy. When I reach out to support or thank a colleague, this gives me joy. And when I'm the patient, I always thank all the staff for the hard work and dedication, their hard work, the front desk staff, the technologists, the nurses, the physicians, and this gives me joy. So I call our mission on the ACR PFCC Outreach Committee the joyful triad of healthcare success.
So interesting. And I'm just struck by your description there. I think a term for that I've heard is soft leadership skills. And I'm always hesitant to say soft because those are so key. And I feel like they play into this triad you're talking about.
Yeah, no, it's exactly. It's extremely important. And I agree with you. I don't think it's soft leadership skills. I think it's what we all should be doing to improve well-being ourselves and to be reaching out to our colleagues. So spot on.
Interesting. Well, focusing on well-being, which is part of what you were talking about there, why has physician well-being become such an important concept in recent years, in your opinion?
Yeah, achieving and maintaining well-being, as you said, is extremely important, and it has become even more important. And two reasons come to mind. The first is that clinicians need to be well to provide excellent patient care. And the second is that the great resignation of healthcare workers that we're experiencing, we've heard this term, the great resignation, in large part due to burnout, is resulting in a large number of our healthcare colleagues who are just leaving the profession. And the healthcare industry is the second largest industry that's been affected by the great resignation. It's resulting in a loss of 20% of our health workforce. Our overall health employment is down by about 500,000 people, 500,000 workers. And a very disturbing statistic I came across, which I keep on seeing, is as predicted by 2025, nearly 50% of our healthcare workforce will leave medicine. And obviously this will destabilize healthcare delivery in the US. It's clearly a public health crisis. And additionally, this is very concerning to me because for many of us, healthcare is a mission, it's a calling. And we historically have seen physicians working as they age into their 80s. So for physicians who retire early, something is seriously wrong. And I'm already starting to see cracks in the U.S. healthcare system. And I'll share a recent survey I came across. So there was a patient survey that came out in November 2022. It came out a few months later in February 2023. And over this 3-month period, just over 3 months, more Americans are reporting that they're being affected by healthcare staffing shortages. So in November 2022, 25% of Americans said they were being affected by healthcare staff shortages. And 3 months later in February, this increased to 35% of Americans who said they were being affected by healthcare staffing shortages. In November 2022, 73% of Americans said they were experiencing delays and challenges in getting the care they need. 3 months later, that increased to 84%. So more than 4 out of 5 people in America who need healthcare are now experiencing challenges in getting the care they need. And more than half of the people surveyed said they're afraid they won't be able to get needed medical care due to staffing shortages. So this is a real healthcare crisis. And as some examples, ERs are closing in Canada, rural hospitals continue to close in the US. At least 136 rural hospitals and health systems have closed in the US, and more are predicted to close in part due to staffing shortages. And radiology is experiencing workplace shortages. As an example, our radiology colleagues around the world are also experiencing workplace shortages, and I'll give you an example. So in British Columbia, Canada, hundreds of thousands of patients are waiting to get imaging studies. So hundreds of thousands of patients are on an imaging list waiting to get imaging studies. So if you're a woman in British Columbia and you have a breast mass, you may have to wait a month to get a breast biopsy, which is just unbelievable when you think about that. In the UK, they're short about 1,700 radiologists. This has been a problem for years, and we need to know what's happening around the world to our colleagues, because what's happening to our radiology colleagues in the world is a warning of what may happen to us in the US. So we need to mitigate burnout, and we need to maintain our healthcare workforce.
Yeah, and we'll talk about access to care in a little bit. I'm so glad you foreshadowed that for us, because that is a huge part of an approach to care that's rapidly gaining steam, which is called population health management, which we've covered on other episodes. So we won't get too far into that today, but I would recommend our viewers to go back and watch some of those past episodes. It plays right into what you're talking about. And my other thought, so many thoughts come up when you say what you said, is that with the news that's radiology among almost all specialties has done one of the best as far as matching this year. I think that what your sentiment can get a little bit lost in the good news. So we want to emphasize the good news, but also as a backdrop, a lot of other specialties and fields of medicine are not so fortunate, and those are future teammates of those people who matched. So Joyful Triad flows through all of medicine, it sounds like, and something to keep in mind. So
definitely.
Excellent. Well, I'd like to know a little bit more about leadership and well-being, if you'd indulge me. Whether they be practice leaders, department chairs, or other sorts of leaders. I'm wondering how can those in leadership positions, and maybe those who don't currently have a leadership position but want to show some leadership, how do they best assess and understand the well-being needs of their colleagues?
Yeah, no, that's excellent. And you brought up a great point. We're all leaders. We all lead. We all lead by example. We when we follow, we lead. We're all leaders. And especially if you lead an organization, leaders need to be involved and they need to be present, because they define the culture. They define the culture of the organization. And especially with well-being now, they need to be actively speaking with their colleagues to prevent burnout, right? And when I think of leaders, I put leaders into 2 broad categories. There's the traditional leaders that we're all familiar with, and there's servant leaders. And both leaders are driven to meet the goals of the organization, but servant leaders are also concerned about the well-being of their team. So servant leaders reach out to their colleagues, they get to know them. They ask questions like, what excites you about coming to work? How can I help you grow professionally? And when leaders make this effort, it mitigates burnout. And leaders need to listen to their colleagues. And they really active listening. They really have to listen. And they should be regularly walking through the department, talking to their colleagues, getting a sense of what factors may be leading to burnout. And then leaders should be working with their colleagues, with their teams, to develop solutions to mitigate burnout. And this is what servant leaders do, and it works.
It's so interesting. You could probably just do a whole show about strategies for intervening and ensuring that burnout, probably just intervening sooner so the burnout doesn't even happen to begin with. So
exactly.
But maybe we'll have you back in the future and have you talk about that. Well, to lead us into discussion on health equity, which we've touched on a little bit before, I'd like to ask you about access to care issues, what we just were kind of talking about a little bit ago. Since reduced access to care is one factor that drives healthcare disparities out there, do you see a connection between physician burnout and access to care for underserved communities? And if so, how can improving physician wellness actually positively affect patient care?
Yeah, definitely. And I'm happy to also share some strategy about how we can mitigate burnout as well. If you want, we can tackle it as well, because there's some interesting studies that have come up. But let me address this question first about the health equity,
Sure.
Which is that, as you mentioned, there's definitely a connection between physician burnout and access to care for underserved communities. And access to care is critically important to reducing healthcare disparities. And as physicians burn out and leave medicine, we're experiencing larger and larger healthcare deserts in our nation. And we're seeing this to a larger extent in rural communities and underserved communities. If patients don't have access to healthcare professionals, or care will suffer, underserved communities will suffer. And this increases healthcare disparities because physicians need to be well, and they need to continue seeing patients to provide all patients with the healthcare that they need.
Interesting. Yeah, and I guess that plays into that quadruple aim of the IHI and other places that it's nice. I think it's probably gratifying, I would think, to see that the idea is gaining traction. But yeah.
Yeah, and I can talk about some strategies if you want.
Sure, absolutely.
Because I think it's really important. There's been a couple of articles which have come out which are really powerful, and I think it's going to help us. In fact, they just came out in October of 2022, and this is really powerful stuff. So the National Academy of Medicine and the U.S. Surgeon General, they just released 2 landmark consensus reports which outline strategies to reduce burnout. And the National Academy of Medicine, they've been working on this for 6 years to develop their well-being recommendations. And they call their new recommendations the National Plan for Health Workforce Wellbeing. And for those of you who are not familiar with the National Academy of Medicine, it's a highly respected organization. It's a think tank. And their recommendations, their well-being recommendations, were built upon input from a network of over 200 organizations. So they really did their work. And they reached out to the public. They got 2,000 comments that came in. And then they put together their plan. They listened to lots of people. And their information is very powerful. And we really need this now. So what they did is they've made 6 initial recommendations to improve well-being of the National Academy of Medicine. And the first recommendation they made is we have to advance organizational commitment. Organizations have to be committed to mitigating burnout. We need to strengthen leadership behaviors. So we get back to servant leadership that we've talked about. They need to conduct workplace assessments. They have to examine policies and practices. They have to examine workplace efficiency. And then one very important point, they have to cultivate a culture of connection and support among their teams. And the NAM now has put out these recommendations, and they're getting feedback, and they'll make additional recommendations as more people kind of reflect on this. The U.S. Surgeon General, he's identified 5 current priorities, and 2 of his 5 priorities are health worker burnout and supporting workplace mental health and well-being. So this is a national issue. I mean, this is happening across the nation. And like the National Academy of Medicine, the U.S. Surgeon General, they also released their recommendations to improve mental health and well-being in October. So everything happened just a few months ago.
Yeah.
And the U.S. Surgeon General, they defined 5 essential, what they call support engines for workplace well-being, and they're all interconnected. And each of the 5 support engines are grounded in 2 human needs. So the 5 support engines are protection from harm. So one should feel that one's in a safe and secure environment. Connection and community. Again, we come back to connection and community. One should feel one belongs, that there's social support within one's workplace. Work-life harmony. People should feel they have some flexibility, autonomy. That can be working from home, spending more time with your family. People working with employees to make sure they have this work-life harmony. Mattering at work is very important. One should feel that there's meaning at their work, that they have dignity when they come to work. They should be treated with respect. And a very important concept, which is opportunity for growth. The people should always feel that they're learning on their job, they're accomplishing things. I mean, these are all very fundamental concepts to help well-being. And again, I want to emphasize that both the NAM and the U.S. Surgeon General, they emphasize a culture of connection and support as one of their priorities. And I want to take a look at VA for a second. I work for VA, and it's a great example to see how a big healthcare organization is dealing with this. So VHA is America's largest integrated healthcare system. It has more than 380,000 employees, so hundreds and hundreds of thousands of employees. How do you mitigate burnout across such a large scale? So they provide care to nearly 1,300 healthcare facilities. They serve 171 medical centers. They serve 9 million veterans each year. And in the fall of 2021, VHA was also concerned about burnout in their workforce. So they put together a national task force to address burnout, which is called Reboot. And I love the name Reboot. It stands for Reduce Employee Burnout, Optimize Organizational Thriving. And I was actually appointed to serve in this National Reboot Task Force by the VA Undersecretary of Health because I have an interest in cultivating well-being for my colleagues. I've been doing a lot of work through ACR on this for many years. So we all participate in weekly meetings. We participate in weekly meetings for about 6 months. design well-being strategies based on feedback from our colleagues in VHA. And we launched our recommendations in September of 2022, just before NAM and US Surgeon General came out with their recommendations. So we have 7 initial focus areas that we've implemented. And the first is that we feel it's very important to have a clinician well-being officer. So we have a chief clinician well-being officer who's kind of looking at all these things and trying to coordinate things. Also optimize meetings so that meetings are streamlined, don't impact on people's schedules. Optimize our learning system. We have something called the TMS, time management system, where we have to take courses periodically. They want that to be streamlined so it doesn't impact on people's schedules. We want to strengthen mental health support. You always hear mental health support is very important VA for the veterans, also for the employees as well. We want to address inefficiencies in the workplace. So again, we do what we can to help people if it comes, whatever it takes, from computers to reach out to people for help. We want to maximize the use of HR policies and flexibilities. I know you heard that before, where you give people some flexibility to work at home, to feel that they can do things which helps their work-life harmony. And again, strengthen the culture of servant leadership. So again, we return to servant leadership, which I discussed earlier, which is a servant leadership is concerned about their team. A servant leader cultivates a culture of connection and support, which National Academy of Medicine, US Surgeon General talked about. So these same themes to improve well-being are coming up over and over and over again. And this is what we need to do as a collaborative community to improve well-being. And why are these recent recommendations from NAM, US Surgeon General, Veterans Health Administration so important? Why am I more hopeful now that we can achieve well-being with the recent publication of the recommendations that were just released a few months ago? Well, we now have data. It all comes down to data. If we hope to move the needle toward well-being, we need data. And we can now go to leadership and we can say, it doesn't make a difference what I think about well-being. It doesn't make a difference what you think about well-being. This is what our colleagues, this is what the experts are saying. We need to work together, clinicians, administrators working together to achieve well-being. Otherwise, we'll lose more and more staff. We'll continue to lose more and more staff to the Great Resignation. And this impacts patient care. We're all patients. So being well affects all of us.
That's so interesting, the way you explain that, because on the surface of it, I would think that, going to, maybe, for instance, administrators or C-suite and saying, I know there, like we talked about earlier, I know there's a physician shortfall, at least with physicians, if not also, other types of healthcare workers. So for the physicians and healthcare workers we have managed to retain, can we give them more time off, or can we, accommodate them? So sometimes, if you look at it just on the surface, it might seem counterintuitive that's the environment into which you should be deploying these burnout mitigation strategies. But I think the way that you filled it in with the other accommodations you're talking about, and just really trying to balance work-life balance, anyway, that was just very interesting. So I don't know if you had any thoughts on the kind of counterintuitive nature maybe of it.
Yeah, no, that's an excellent point, because you're right. I mean, people do need time to go home and heal and walk outside in nature and spend time with their families, but we have less employees. So I mean, there's strategies they're using now to try to do this. One is that they're using AI perhaps to help, so that it takes away a lot of the busy work from clinicians. AI can help with that, so it allows more time for people to focus on what's important to them, which is many times spending more time with patients, being more efficient so they can get home and spend time with their family. So we have to do more with less. So AI is a strategy for sure. And then for the employees which are hanging in there, and we have less and less, it becomes even more important for our colleagues, our servant leaders, to make sure we're identifying what's important to people. So someone may say, I wanted to spend more time with my family. How can you help me? Well, if you can allow people to work from home a couple of days a week, that could really help them, because it takes the time off when they travel on both ends. If someone says, well, I really enjoy teaching or learning or going to conferences or doing advocacy nationally, and they say, well, let's see if we can help you with that. There's a conference coming up. When you go to that one, bring back some ideas to the center to help us as well. And then you're supporting people's needs. And just seeing that people are concerned about people's human needs, that can do a lot. And when people feel they're part of the team, we all know we're faced right now with less and less staff. But as long as we know that leadership is looking out for us and we're all working together and we're communicating and we're having transparent leadership, ethical leadership, where people are communicating, being transparent, that's about as, I think we'll be fine. But we definitely have to do that. And unfortunately, it's not happening everywhere. And that's why we're seeing people leave and just resign and saying, I'm done. So Great
Yeah,
question.
absolutely. No, it's so interesting. I'm sure we could talk just on that topic in a whole episode. So, again, we'll have to have you back. Well, staying on the topic of health equity, which we've talked about a little bit, in addition to your other titles, you're also president of the Wisconsin Radiological Society, and that the society is actually a coalition partner to the Radiology Health Equity Coalition. And I'll ask you to speak about that in a minute, but we'll definitely provide a link in the show notes for people to get up to speed on that. So, can you please tell us a little bit about what the Radiology Health Equity Coalition is, and maybe provide your insights into how radiologists can can go about improving health equity both regionally and nationally?
Yeah, definitely. And for those of you who think about what health equity is and why it's important for health equity, I'll talk about that, and then we'll kind of lead into those other things that you've talked about, because it's all important. All kind of ties together. And health equity is part of our joyful triad of healthcare success on our committee. But I think it's important to look at health equity because I really feel it's the next evolution of patient and family-centered care. So part of what I call the joyful triad of healthcare success. And health equity is when everyone has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving their health potential because of social position or other socially determined circumstances. And the good news is that health disparities are preventable, and we can all collectively work together to prevent healthcare disparities in our community. And getting to what you're talking about, I think of three strategies that we can use to achieve health equity, and they're all interconnected. The first is awareness and education. The second is research. The third is advocacy, which ties into what you mentioned. And I'll give some examples. So as an example of using awareness and education to achieve health equity, as the president of the Wisconsin Radiology Society, I organized a panel discussion on health equity at a recent 2023 annual meeting, which occurred a couple of weeks ago on April 1st, 2023. And it was a fantastic discussion. We all exchanged ideas. We proposed strategies to increase health equity for all our patients. Here's another example of using awareness and education to increase health equity. My partner and I, Dr. Narayan, who's on the ACR PFC Outreach Committee, helped launch the new Radiology Health Equity Coalition webinar series last year, where we both spoke on the role of patient-centered care and achieving health equity for our patients, for all our patients. And the seminar was recorded and it's available to view for free on the Radiology Health Equity Coalition website. And for those of you not familiar with the Radiology Health Equity Coalition, it launched in late 2021. It was created to mitigate healthcare disparities in our patients with the support of radiologists across the country. And it was initially comprised of multiple national radiology organizations: the American College of Radiology, the Radiology Society of North America, the American Board of Radiology, the American Medical Association, Section Council on Radiology, and the Radiology Health Equity Coalition is actively growing. In fact, on July 27th, 2022, on my presidency, the Wisconsin Radiology Society became the 6th Radiology Coalition state partner in the United States to join the Radiology Health Equity Coalition. And I'm very proud of our members for supporting this cause. Our Radiology State Society in Wisconsin is collectively moving the needle toward health equity. A second really important strategy to achieving health equity is research. And a very concerning report came out of the National Academy of Science, Engineering, and Medicine in May of 2022, and it was a congressionally mandated report. And they found that the lack of representation in research is compounding disparities in health outcomes for underrepresented groups and for the nation. And that this lack of representation in research will cost many lives and hundreds of billions of dollars for the US. And we cannot afford to lose more lives in our community, and we cannot afford more public debt. The US currently has $31.5 trillion of public debt, total public debt. So achieving health equity is important to reducing our country's large public debt, and achieving health equity saves people's lives. Advocacy. So advocacy is a third strategy to achieving health equity. It's also critically important. Both radiologists, non-radiologists, they can lend their support to their state and national medical societies to support health equity, to achieve health equity. Advocate with your patients, advocate with your colleagues, make your voice heard on social media, with your legislature, at the voting booth. And together, if we work together, we can achieve health equity for all people.
We mentioned towards the top that you chair a PFCC commission. That's the Patient Family Centered Care Commission here at ACR, and you actually chair the outreach committee of that commission. And that committee in particular is just deeply committed to health equity. I know you guys do a lot of great work over there. And so, what are some, if you could share with the audience, what are some past successes you've had in moving radiology in a more patient-centered direction, and maybe some what current projects you're working on, and maybe you have some things you have your sights set on for the future?
Yeah, no, definitely. So we're following our mission on the ACR PFC's outreach committee on what I call the joyful triad of healthcare success. So improving patient and family-centered care, improving health equity, improving clinician well-being. And some recent successes that we've had as president of the Wisconsin Radiology Society, I developed a two-part national seminar which discussed strategies to improve well-being. Mm-hmm. And this was a collaboration with the Radiology Leadership Institute, the ACR Wellbeing Committee, and we launched the first part of the Wellbeing Seminar in December 2022, and the second part of the Wellbeing Seminar a couple of weeks ago, April 1st, at the Wisconsin Radiology Society's 2023 annual meeting. And both parts of the Wellbeing Seminar were recorded and can be found on the Wisconsin Radiology Society website. And it was, again, a tremendous discussion. We discussed strategies to improve well-being. We exchanged ideas. We proposed solutions. And I just received some exciting news last week that this important well-being initiative that I developed was selected by the Radiology Leadership Institute, for the 2023 Impact and Leadership Award. And that's great news. Thank you. I mean, that's great news because now more people are going to learn about this well-being seminar. And the whole point of this whole thing is for people to learn, where we can discuss things, and where we need to keep well by continuing to discuss these things and discuss these things. And they can watch these two well-being seminars for free. They're both archived now on the Wisconsin Radiology Society website. So another recent success, I wrote a special focus issue on well-being with my colleagues for the JCR. It was a special focus issue. It was just recently published. And this recent article, important article, discusses strategies and resources to reduce burnout for radiologists in academia, in private practice, at the VHA. Another success, my partner, Dr. Narayan, on the ACR PFC Outreach Committee, who is the inaugural Vice Chair of Health Equity at the University of Wisconsin. And by the way, I think Dr. Narayan would be an excellent, another wonderful thought leader to learn from on this excellent
Absolutely.
ACR podcast series. But of our success, Dr. Narayan and I formed a collaboration with our counterparts in health equity at the RSNA, Dr. Flores, Dr. Spoluto. We're also doing excellent work in reducing health disparities and are also vice chairs of health equity at their respective institutions. And we've combined forces between our two committees within the ACR and the RSNA, and we're reaching out now to our respective committee members and to radiologists in our community to highlight challenges and successes they've had in achieving health equity. And we'll be posting these important discussions on the Radiology Health Equity Coalition website for people to learn from. We're also concurrently developing a national lecture series with our committee members from the ACR PFC Outreach Committee to highlight the excellent work they're doing in their institutions and in their community. And their work provides excellent examples of our mission from the PFC Outreach Committee to the joyful triad of healthcare success. So improving patient and family-centered care, improving health equity, improving well-being. So the ACR PFC Outreach Committee, we made a tremendous difference in continuing to improve patient care across the nation.
That's excellent. Well, I think that's a great place to leave it. And, for our listeners, I know, Dr. Weissman, you're an avid user of Twitter. So we'll go ahead and include your handle there. And if it's okay with you, hopefully some audience members can reach out and find out more about all the interesting programs you talked about today. And so, let us know if you happen to be on Twitter and you're an audience member, please let us know, your thoughts on this or any other issues at Radiology ACR. And please include hashtag ACR Bulletin Podcast in your tweet. I also invite our audience to check out all our past episodes on Apple Podcasts, Spotify, Google Podcasts, and be sure to subscribe to ACR's YouTube channel to stay up to date on our latest episodes. And please do hit that like button on this video if you found it valuable. Thanks again, Dr. Weissman. We really, really appreciate you coming today.
Thank you, Chris. It's been my great pleasure. And thanks again for the excellent work and for this tremendous ACR Bulletin podcast series. Thank you.
Thank you. And thanks to our listeners. This has been the ACR Bulletin Podcast. See you next time.